All right. Hi, everybody. My name is Melissa Marriott. My presentation is on mild traumatic brain injury. First off, I wanted to acknowledge that Fraser Health is located in the unceded and traditional homelands of the Coast Salish. Since we're not meeting face-to-face, I wanted to give you a bit of a background about myself and help you put a face to a name. I'm originally from Victoria. I currently live in Langley, BC, and I work for Fraser Health. For the first 6 years, I worked in information management and technology, implementing and supporting electronic health records. During that time, I started my master's in public health way back in 2015. It's been a busy few years. I married this guy. I had a beautiful baby girl who's now 3. 18 months ago, I took a position as a project leader supporting palliative care services. I'm very much looking forward to completing this master's. My practicum was completed with Fraser Health Acquired Brain Injury Services with a focus on the Fraser Health Concussion Clinic. So the presentation today is going to break down into 3 parts. The first part is regarding the literature review of mild traumatic brain injury. Part 2 is regarding Fraser Health Concussion Clinic and the concussion burden across Fraser Health. In part 3, I'll talk about recommendations. The first step was to orient myself to the services and the jargon. So what is mild traumatic brain injury? For the purpose of the presentation, concussion and mild traumatic brain injury are used interchangeably. I'm referring to a mild, non-penetrating injury that results in temporary alteration of brain function. So the key piece there being temporary. Symptoms can include headaches, nausea, vomiting, confusion, amnesia, and balance and coordination issues. So once I knew what a concussion was, I proceeded to do the literature review. The date range was restricted to the last 10 years. Canadian articles were preferred and included based on relevance. So what did the literature tell me? In British Columbia, an average of 600 people are hospitalized every year due to concussion. Roughly 14,500 visit an emergency department. I just want to point out that these numbers are likely underestimates of the real concussion burden because of limited public awareness. Somebody who has a concussion may not seek treatment. Data collection in the community is also different from a hospital reporting data. So when you go CP, that data is not collected in the same way. The literature also identified that children, particularly newborn to 4 years of age, adolescents between the ages of 15 to 24, seniors over 60, and males of any group are more likely to experience concussion. I also wanted to point out that adolescents and children take longer than an adult to recover from a concussion. Concussions can permanently impact the way in which a child or adolescent learns, speaks, and interacts with other people. Another vulnerable population that came up in the literature was the homeless and marginally housed. One recent study from 2019 indicated that more than half of the homeless and marginally housed population have a lifetime history of traumatic brain injury. So I found that number quite significant, and I wanted to share that with you. In the literature review, I also discussed health promotion and prevention. Parachute is a Canadian nonprofit seeking to prevent serious injury through evidence-based methods. One program developed by Parachute is Brainwaves, a free half-day education presentation for youth grades 4 to 6. In 2018, 30,000 children learned about the anatomy of the brain, why it is important to protect it, and strategies in injury prevention. Parachute is leading the standardization of concussion guidelines and protocols across the country. This project will help to ensure that concussion protocols are consistent across Canada. Another piece that really struck me in the literature review was the story of Rowan, which resulted in Rowan's Law. Rowan Stringer was a 17-year-old grade 12 student from Ontario. She passed away May 12, 2013, following a concussion sustained during a high school rugby match. She likely died from second impact, which occurs when the brain swells quickly following a second concussion, before symptoms from a first concussion have resolved. Rowan had likely sustained 2 previous concussions prior to the final fatal concussion. Her death resulted in Rowan's Law. It is now mandatory for sports organizations to ensure athletes under 26 years of age, parents of athletes under the age of 18, coaches, trainers, and officials to confirm that they have reviewed Ontario's concussion awareness resources every year. So we've talked about the literature. In the next section, I'm going to talk about Fraser Health and the Concussion Clinic specifically. Fraser Health is one of 5 regional health authorities located in British Columbia. It delivers healthcare services to communities from Burnaby to Hope. General health status declines from west to east. The Fraser Health region is also home to a significant number of people belonging to ethnic minority groups, and there is a large First Nations population. Now, the Fraser Health Concussion Clinic provides early intervention, tertiary prevention services post-concussion, and they focus on education, ideally targeting individuals less than 12 weeks post-injury. One of the main questions asked by Fraser Health leadership was to determine which populations currently access the concussion clinic and which populations are not. So the data. I was able to engage the Fraser Health Population Health Observatory, and I was able to pull data for the 2018-2019 fiscal year to include all age groups. I was building on a previous report that was developed by the BC Injury Prevention Unit. However, the report they developed was only for ages 0 to 19. So key point, 9,530 concussion-related visits seen in the 2018-2019 fiscal year. Higher number of males to females. Again, young people were in the leading age groups seen in Emerge. So it was nice to see that what I'd seen in the literature was reflected in the data. So the Fraser Health Concussion Clinic manually collects data. And this table here reflects that. So Fraser East is showing a lower number of referrals. I wanted to highlight that. According to BC Injury Prevention, that existing report I already mentioned, Fraser East actually has a higher number of concussions in comparison to the rest of Fraser Health. So I was surprised to see a lower number of referrals actually getting to the concussion clinic for Fraser East. Also, from that previous slide of 9,530 clients, it seems that we're seeing a relatively small number of referrals coming to the concussion clinic when compared to this overall number. So possible barriers to service. There was 2 things that came up during my practicum, accessibility and language. The Fraser Health Concussion Clinic was located in Coquitlam and has since moved east to Langley. This change shifts the clinic to a more central location geographically. However, neither location are near a SkyTrain terminal or are particularly accessible to those individuals without a vehicle. Also, language. In speaking with the physician at the clinic, he told me he sees very few individuals where language is a barrier during their appointment. Now, I don't have any data to support this. This is anecdotal, but I thought it was worth pointing out. Given the diversity of Fraser Health population, it seemed unusual. So recommendations. So we've talked about the literature, we've talked about the data. Now what? I couldn't fully answer the question of who is accessing and who is not accessing services at the concussion clinic. So I would start with my recommendation that there needs to be more and better data, and no more manual data capture. That for myself with a informatics background, it really does hurt my heart when I see Excel spreadsheets capturing data. They have an existing EMR, so my recommendation is to optimize the use to create better reports. And there are some quick wins. So their existing education material is only offered in English. I suggested that they translate into the most common languages already in Fraser Health. And also to review education delivery methods. They send out a lot of paper-based material out to clients. And I think in terms of the population that they might be trying to target, such as adolescents and youth, that looking at some electronic means might actually be better. So ultimately, I felt that I wanted to do more with this project, and given the circumstances with COVID, I'm sad that that has happened. But given that I already work for Fraser, I'm hoping that my director will let me down the road do a little bit more work in this area and do further engagement with the Population Health Observatory so that we can finish building on that report. So I just wanted to give a quick thanks to Andrew Fairburn, who was the manager of the Concussion Clinic, my director, Tammy Hardiman, the Concussion Clinic, Helen, Mark, and Megan, who all work at Fraser Health. Thank you for your support. Victoria, thank you for all your feedback and helping to make this project very interesting and make it fit within the time limits and subject content. And to my husband, Brad, and my daughter, thank you for putting up with me.
Awesome. Thank you, Melissa. That was great. Okay, I really appreciated your presentation, and knowing a little bit about the history of your project. Such a nice way, the way that you went about kind of merging together public health, health services, incorporating an equity lens there in terms of your recommendations, and the determinants of health. Yeah, really nice work. Thanks so much. Questions for Melissa? And again, you're welcome to provide comments verbally as well if you'd like. Okay, Nigel, go for it.
Great presentation, Melissa. Actually, I'm just interested in, and I don't know if you came across this in your review of the literature, but the differences between MTBA and TBA. And I just wondered, is there any evidence of subjects who've suffered from MTBA have been prone to social isolation in terms of just distancing themselves from family and friends, as is very classic with the TBA type patients?
Hi, Nigel. That wouldn't surprise me. One article that I did read had some interesting pieces around predisposition to concussion. One of them included somebody who's prone to depression or anxiety often has protracted recovery times. So that's not quite answering your question, but I think it's similar. It wouldn't surprise me